Had unprotected sex and worried about pregnancy? Don't panic. There's still something you can do. Let's talk about emergency contraception, how it works, and which option might be right for you. Emergency contraception, often called the morning after pill or backup birth control, is a safe way to prevent pregnancy after unprotected sex. It's not an abortion pill. It doesn't end an existing pregnancy. You might need it if a condom broke, you forgot your pill, or had unprotected sex. Emergency contraception helps prevent pregnancy after sex, not before. You might use it if your regular birth control failed or wasn't used at all. It's also important after sexual assault, when unprotected sex occurs against someone's will. Emergency contraception works mainly by delaying ovulation. That's when the ovary releases an egg. If no egg is released, there's nothing for sperm to fertilize. Today, we'll explore the two main types, how each works, and how to decide which one suits you best. There are two main types of emergency contraception. The first is intrauterine device, a small device inserted into the uterus by a doctor or nurse. One IUD type contains copper, which makes the uterus a hostile environment for sperm. The other releases a hormone called progestin, which thickens cervical mucus, blocking sperm movement and prevents ovulation. Second is emergency contraceptive pills, taken by mouth. These are faster to access and don't need a procedure. So how do you choose? It depends on several factors. Ease of access. IUDs need a clinic visit and may cost more depending on insurance. Some pills are available over the counter. Others need a prescription. Effectiveness. The IUD is the most effective, preventing over 99% of pregnancies when used within 5 days. Pills are effective too, but a bit less so. Future birth control. If you'd like ongoing protection, an IUD might be perfect. A copper IUD lasts up to 10 years. A progestin IUD lasts up to 8 years. Body weight. If you weigh 75 kilograms or more, an IUD works better than pills. Pills like ulipristal may still work, but could be less effective in higher body weight. Timing. The sooner you use emergency contraception, the better it works. If you had unprotected sex twice this week, would the same method still work? Let's see what the timing means next. If you choose the IUD, it must be inserted within 5 days after unprotected sex. It starts working immediately and continues to protect long-term. If you choose pills, timing matters. Ulipristal works up to 5 days after sex. Prescription usually needed. Levonorgestrel works best within 3 days. Available without a prescription in many pharmacies. Mifepristone, used in some countries, it is effective when taken within 6 days after unprotected intercourse. Dose used for emergency contraception is much lower than the dose used for medication abortion. Regular birth control pills can be used for emergency contraception, but less effective. You have to take more than one birth control pill at a time, and a second dose 12 hours after the first dose, and may cause nausea. Some people feel nauseated after taking emergency contraception. If you vomit within 1 hour of taking birth control pills, repeat the dose. Before taking emergency contraception, you can take a medicine called meclizine that helps keep you from vomiting. You can get it in pharmacies without prescription. Ulipristal and levonorgestrel are less likely than birth control pills to make you vomit. If you vomit within 3 hours of taking ulipristal or within 2 hours of levonorgestrel, call your doctor. You may need another dose. Your period should come around the usual time, or within a week of when expected. If you took ulipristal, your period might be slightly delayed. If you don't get your period within 3 to 4 weeks, take a pregnancy test. Also remember, if you used ulipristal, wait at least 5 days before restarting regular birth control pills. Use condoms in the meantime to stay protected. If you experience heavy bleeding or belly pain, see a doctor right away. Even though some emergency pills are sold without a prescription, they might not always be easy to find when you need them most. That's why many healthcare providers recommend keeping a pack at home, just in case. But remember, this is not meant for regular use. For consistent protection, choose a reliable birth control method that fits your lifestyle. Emergency contraception is a safe and effective way to prevent pregnancy after unprotected sex. But choosing the right type depends on your timing, body, and plans for future birth control. If you found this helpful, hit like, subscribe, and turn on notifications. so you never miss a clear, evidence-based guide to medicines and reproductive health.